Hi, my name is Dr. Sam Sunshine. Welcome. Today's podcast is going to be on a anti-aging medication called rapamycin. And this is going to be a household name. I'm guessing in probably 5 to 10 years. There is quite a bit of research now looking at the uses of this medication. Again, it's called rapamycin. I'll be talking about that and how it works and what are some future possible uses of this medication. And then keeping in mind that things like eating healthy, regular exercise, proper sleep, and stress reduction also are great ways to slow the aging process. So I'm going to share my screen and we'll get started. And so rapamycin, this prolongevity therapy, it comes in pill form and has been, again, was first discovered in 1999, was FDA approved in 2009 for certain conditions that I'll talk about. So we talk about longevity. What are some of the drivers of longevity? And I mentioned this just briefly, but caloric restriction or nutrient restriction has been shown to increase a condition called autophagy or cell death, which sounds bad, but actually these aging cells we want to die and recycle. And that is part of a condition called autophagy. And this caloric restriction, nutrient restriction increases autophagy and actually helps improve longevity and is an anti-aging tool, as well as fasting. Intermittent fasting, some people do water fasting, juice fasting, can also be very effective in increasing autophagy and promoting cell lifespan. And then rapamycin, again, we'll be talking about its use. Right now, pulse therapy seems to be the recommended dosing prescription rather than continuous use. And I'll talk a little bit about that, but continuous dosing seems to have some untoward side effects that I'll mention. But again, proper sleep, proper nutrition, regular exercise, and stress reduction, which I try to hammer home, is really the foundation for healthy aging and maintaining a healthy lifespan. So this picture on the right is a study done in mice, and this was in 2009. And this is one of the first studies. It was really a landmark study. What they showed is treating mice with rapamycin, it increased their maximum lifespan by 17%. And that was really eye-opening. And later, subsequent studies have shown increased lifespan up to 30%, depending on when it's initiated and how it's dosed. So rapamycin is a macrolide immunosuppressant. It's interesting that it was discovered on Easter Island in a soil sample. And it was first used as an antifungal, or actually, I take that back. It was discovered as an antifungal metabolite produced by Streptomyces hygroscopicus. It's an inhibitor of MTOR. And I'm going to talk a lot about MTOR. What that stands for is mammalian target of rapamycin. And that's really, I'll talk a little bit more about that. So I'll get into the details of what MTOR is and what it does. But it's really a master regulator of cell growth and metabolism. We all have it in our cells. And some people have dysfunction. And if you have dysfunction of that MTOR pathway, you're going to have major problems with things like muscular dystrophy. Or some people have alterations in that, leads to dermatologic conditions that can be pretty severe. And the picture on the right is the molecule of rapamycin, pretty complicated molecule. Other macrolides that you guys might be familiar with are Zithromax or the Z-Pak, erythromycin, chloriphromycin, or Biaxin. And these macrolide analogs, they're somewhat similar and they do different things depending on if they're 14 or 15 member macrolides, but they can have antibacterial effects, and that's where we primarily use them. So again, if you have a sinus infection, pneumonia, you're going to be prescribed Zithromax oftentimes. It has anti-inflammatory properties, and it's being used to treat COVID patients who are hospitalized and in respiratory distress because of its anti-inflammatory effects. Also can have regulation of gastrointestinal mobility and have anti-cancer effects. So we'll talk a little bit about that as well. So rapamycin is currently available. Its brand name is called Everolinus. It is an FDA-approved drug, and it is an immunosuppressant, and it's used for that reason. It does inhibit mTOR, which again is a mammalian target of rapamycin. Does extend lifespan in various organisms. So this is where it gets exciting. You know, in mice, worms, yeast, and flies, you get significant prolongation of life using this drug. So next, we're going to talk about mTOR. So again, if you're not confused by now, I'm sure this slide will seal that fate. But mTOR is in the middle. And if you look above that, you'll see nutrients, insulin, and growth factors. Those are the things that stimulate mTOR. Those are good things. We all want nutrients. We all want to make insulin, and we all want growth factors. So mTOR is not bad. And it does help with cell proliferation. But as we get older, it does increase cell growth and aging. It accelerates the aging process. It does help with insulin secretion, beta cell growth, and exhaustion. Those are the cells that make insulin. It also stimulates fat synthesis, and it also increases insulin insensitivity, which is not what we want. We want insulin sensitivity. It blocks ketogenesis, so the formation of ketones, and then it also blocks fat metabolism or lipolysis, as well as blood sugar production or gluconeogenesis. That's the formation of new sugar molecules. So again, mTOR does a variety of different things. Again, we need it. It's good. We want it. And to make it even more confusing, there's two mTOR complexes, and they do different things. So there's the mTOR complex 1, which is really what we're going to focus on. That's the modulator of aging and age-related diseases. And if we inhibit that mTOR complex 1, it seems to extend life in those species I just talked about, the worms, the yeast, the mice, and flies. And then there's the mTOR complex 2, and that participates in cell survival. It regulates the organization of cell physiology. And its inhibition, if we inhibit the mTOR complex 2, it can have negative effects on human cells. So, you know, the scientists that are studying this are really looking at how do we selectively inhibit mTOR complex 1 without interfering with mTOR complex 2, and that's what we'll talk about. So when we look at mTOR signaling and aging, again, mTOR is in the center, that oval, it's purple colored, and the rapamycin is just up and to the left of that. And so when you have a line that has a perpendicular line at the base, that's blocking mTOR, so that's a block. If it's an arrowhead, that's a stimulant. So they're not to get too confusing, but rapamycin blocks mTOR, and mTOR blocks autophagy. So if we block mTOR, we allow autophagy to go on, which is good, and that leads to anti-aging. So really uncontrolled mTOR complex 1 mediated signaling is really the basis of a lot of human disease, the acceleration of and the processes that lead to heart disease and stroke and Alzheimer's disease. And that if you were to block this mTOR complex 1 pathway, it can have an anti-aging effect. So hopefully that's somewhat simplified and makes it more understandable. The unfortunate thing about rapamycin is it incompletely blocks the mTOR, does a pretty good job, but once you remove the medication, then the effect on mTOR is also removed. So again, let's talk a little about the benefits. I've kind of alluded to some of the benefits, having an anti-aging effect. But when we're looking at this, we've really only studied mice is probably the main mammalian organism that we've studied. I think there are human studies that are going to be that are currently happening, and it's just a matter of time before we get more data points. We know it has anti-aging properties in mice. It can extend the lifespan of a mouse by about 30%, depending on when you initiate the treatment. It delays the onset of age-related disorders, as I mentioned. It lessens age-related cognitive decline in Alzheimer's disease. And this has been shown in the rat model or in the mice model. And it blocks the progression of atherosclerosis or heart disease. So pretty exciting. So you would think, gosh, why don't we jump on this in humans? Well, we know already it's FDA approved for having an immunosuppressant effect, and it's used in organ transplants for patients who are undergoing, like a kidney transplant, for instance. One of the downsides of using rapamycin is that it has potential side effects. So we look in the graph on the right, when you have low rapamycin, or you're not using rapamycin, the dose is 0. So on the x-axis, you have shorter health and lifespan, and you have more disease. As you increase the dose of rapamycin, you get benefits. And if you're overdosing with rapamycin, you start to get the side effects. And so the question is, what's that sweet spot? How much medicine do you need? And as I mentioned earlier, is intermittent dosing, or we call pulsed therapy, better than continuous therapy? So rapamycin can cause pretty severe side effects, including increased risk of infection or immunosuppression. And that can be upper respiratory infections or urinary tract infections. You can see elevated blood sugar and increased risk of type 2 diabetes. A lot of the studies have looked at what's called pseudo-diabetes, which is not true diabetes. But you also get impaired lipid metabolism, and it can cause testicular dysfunction. Again, most of these are entirely reversible once you stop the medication. Then once you stop the medication, you tend to lose the beneficial effects of the drug. There are now a couple drugs. One is Everolinus, which is an analog, or we call it a rapalog of rapamycin, or a version of rapamycin. And this seems to be more selective for that MTOR complex 1, and seems to leave the MTOR complex 2 alone. So this is in pill form. It's also being used topically by dermatologists to treat, again, these difficult to manage dermatologic conditions, and they're quite a long list. But it, again, it has been used for years. It was brought to market, FDA approved, again, around 2012 for organ transplant therapy. It has also been used to treat renal cell carcinoma. This is a specific type of cancer that involves the kidney, and certain types of advanced breast cancer, especially advanced breast cancer that's not responding to traditional therapy. It is also, as I mentioned, used to treat these difficult to treat dermatologic conditions, and it selectively inhibits the mTOR complex 1. So what about Alzheimer's disease? Again, this affects 5.4 million Americans, and we don't have great treatment. Dale Bredesen at UCLA has written several books that are excellent, looking at how to manage symptoms and maybe even prevent symptoms of Alzheimer's disease. And he uses the metaphor of like having a house with 30 leaks in the roof. You're going to have a multifactorial approach, with diet and proper exercise, supplementation, sleep, stress reduction, to really improve outcomes in patients with Alzheimer's disease. We know the drugs that are commercially available to treat Alzheimer's disease really don't work. So again, this mTOR, which is in the middle, that yellow oval shape, is the mTOR. If you are you get hyperactive activation from some of these, other molecules like AMP kinase, or when that, excuse me, when AMP kinase goes down, it leads to mTOR hyperactivation. And then some of these other molecules I won't get into that seem to activate mTOR. Again, it blocks the autophagy and it increases the risk of this beta amyloid production, or reduces the clearance of beta amyloid, which is the stuff that mucks up the neurons in the brain in people who develop Alzheimer's disease. So we want to be able to clear that beta amyloid, and that mTOR complex 1 hyperactivation that again occurs as we age reduces that clearance. Right now, human studies are pending in looking at proper dosing of rapamycin and maybe some of the rapamycin analogs for treating Alzheimer's disease. So that'll be interesting. At this point, that is being used with, again, rapamycin is FDA approved for the treatment of certain cancers and for immunosuppressant. It can be used in treating anti-aging, again, but there are risks involved with it. So you'd want to work with a doctor who knows proper dosing. When we talk about the future of rapamycin, where do we go from here? Again, this picture on the right is probably hard to read, but it talks about, again, rapamycin in 1999 was FDA approved, and the Everolinus was approved, so correction, 2007, 2008, I think I said 2012 earlier, for advanced renal cell carcinoma. And then in 2011, for neuroendocrine tumors of pancreatic origin. Some of the areas, again, that research is still coming out is on the neurodegenerative diseases like Alzheimer's, on aging, and in metabolic diseases like diabetes and atherosclerosis. And again, is weekly dosing better than daily dosing? I think that's one of the areas that, again, research is ongoing. And for how long do we dose? That's going to be another question. Again, should we be checking serum levels? And it's really going to be personalized dosing, because you give the same dose of a medication to 10 patients, you may have 10 different blood levels. So maybe there's going to be a specific range in which we want to keep blood levels, like we do with hormone replacement and hormone optimization. So that's where the future lies, in using a medication like rapamycin, again, for anti-aging. This again takes me back to my initial slide and statement that there's a lot of things that can improve autophagy and increase lifespan and allow us to age gracefully. Part of that is genetics, so make sure you choose your parents wisely, getting proper sleep, exercise, eating nutritiously, and managing your stress. And that's where we go from here. This last slide, again, I just thought I'd keep this in here. I'm not going to go through this, but this is, again, looking at the mTOR complexes, the mTOR complex 1 and 2, and all the things that they are involved with. So again, pretty cool information. Hopefully this was somewhat easy to understand. There's a lot more research that needs to be done in this area, and we'll know more again in the future. Thank you again for listening. And I'll see if I can go back out. Voila. So again, I'm doing these weekly podcasts on topics that I find interesting and that patients are requesting. So if you have a topic that we haven't discussed, please let me know. ocsportsandwellness.com. Thank you.